Hey everyone. Today I am so excited because I'm going to help you perfect your bloodletting technique and also how you use that bloodletting technique. So, we have a lot to cover today in a very short live video. And if you're not watching this live, hello and welcome from ShinKyu University. Please don't forget to like, subscribe, and hit that little bell to be notified of future videos all about Japanese acupuncture and moxibustion and so much more, including palpation, theory, and a little bit about business practice as well. So without further ado, we're going to get into the bloodletting, and we're going to talk first and foremost about technique, because I think it's something that quite often people are not taught the correct technique with bloodletting. And then also a side note, I often call bloodletting, I call it a paper cut technique because bloodletting is, unfortunately, it just sounds horrible and I don't like how it's called. So the very first thing that I'd like you to understand, and I'm not going to go into too much depth about this, but really understand the tool that you use and the tip of that tool. Now, within ShinKyu University, I really do verse my students quite a bit on understanding the tool you use and understanding the tip, because it's going to really change your technique. I'm going to give you a technique specifically for one of these this is a MediPoint blood lancet. It doesn't really matter on the brand, but if you can see the tip of it, it has what's called a sword tip, which is one of 3 classical tips within needles. So we're going to be using this guy today. If you do use a diabetic, like they're a little diabetic needle, those are slightly different because they're shaped differently actually on the tips. So you have to be careful if you're using those. If you do use those and you're unsure about how to use them, go ahead and comment in the comments below, and I can try to explain it to you. I just don't think I have any of them right here in my toolbox. And also it's kind of hard to show you the tip without going into a lot more information. I do cover this within ShinKyu University within our monthly Zoom classes when we talk all about acupuncture. So if you're interested in that, there's a link in the description box below. You should totally sign up and see if it's a good fit for you. Okay. So let's talk about how we're going to do this technique and how it's really just an extension of your needle tapping. It really is. And so if you have one of these lancets, really, the lancet needle actually has a bit of a curve to it, if you can see there. So it's made to have a curve, and it's made very specifically that way so that the inside, the concave part of the curve, should actually be going against your fingers. Now, obviously, if you're doing this on someone else, you need to follow clean needle technique and wear gloves and all of that because we're doing blood. I'm going to be showing you this right now on an inanimate object that I'm going to grab over here in just a second, simply because it's really difficult for me to show you bloodletting on myself without being like making this super long. So we're going to hold our needle like this. Now, if you look at it from the back side of my middle finger, you can see that you can't see anything, right? It's completely enclosed. That is on purpose. This is the same way that you hold a shonishi needle, actually. And what I'm going to do is I'm going to line up the tip of that needle. If you can see, I'm going to hold it this way so my thumb isn't in the way. I'm going to line it up so the tip of the needle is about at the same point at the middle of the pad of my middle finger, right? And so it's just going to be lined up quite nicely that way. And then I'm going to put pressure here with my thumb to either push it into the pad or to let it float a little bit from the pad. Now, if I was using a teaching tool, I would push it into the pad more because we want it to be a little bit softer on landing. That's a whole nother lesson. For these lancet needles, we're not going to do that. We're going to make it just a little bit off the tip of our pad, just a little bit, because we do want that point to go into the person's skin, obviously, and create a cut. Now, how most people insert their needles, and I'm actually going to show this just on a tissue box here. So I'm going to put this down a little bit. So how most people, let's say that we're going to circle one of these guys. I want to go right here in the middle of this center circle here. And when I do this, notice that this is going to happen on your person too, that sometimes when you push on their skin, let's say if it's on the inner ankle or something like that on a little spider vein, which is often a place that I use this technique, sometimes the skin and the muscle will become a little bit concave when you put pressure on it. So just be really careful with your palpation weight. Sometimes you do want to pull the skin a little taut. As you can see, I'm doing this with the cardboard box here. And then you're going to line your needle up so that way it's right next to the point that you want to do. It's literally hovering above it. And then instead of inserting it, which is how I'm going to do over here, most people, when they insert a blood lancet, they just push it in. And that's all they do. They just stick it in, and then that's it. However, it's going to be a lot less painful if what you place your needle and then pick up your hand. So I'm going to move the camera out a little bit. So I'm going to place my needle down and then pick it up quite quickly. And so what I'm doing is emphasizing what I call the takeoff rather than emphasizing the landing, which is what most people do and why this technique becomes quite painful for a lot of patients. A lot of patients are like, and I know what most people get this technique done in acupuncture school. I know because I've taught the review class for bloodletting at the local school here, CSTCM, several times now. And there's a lot of students that just won't come. They just won't come to class because it's so, so painful. And so I really have to start off and convince the students that your technique doesn't have to be painful and that it can be more exact than what you were originally led to believe. So that's the basic of the technique, that we're holding it and then snapping up. So it's this whole lift up with your dantian rather than just going like this. This is not what we're doing. We're lifting up with our entire body. And I know that's just a little bit of a snippet of this technique, but to really get into it and to really help you understand how you're doing it correctly or incorrectly, unfortunately, I do need to see you, even if it's over a Zoom call one-on-one. So that's something that I get into a little bit more in the ShinKyu University course. When we have our one-on-one monthly study sessions, which is in a group format as well. Yeah, so that's how to start to improve your technique, is trying to emphasize this takeoff. Now let's talk just a little bit about where you should utilize this technique. And it's more than just the Jing wells and the tip of the ear. I think it's called Erjiang, maybe. I might be pronouncing that correctly. If I butchered it, I am so sorry. Really how I learned to use bloodletting. Of course, we did learn on the tips of the fingers at the Jing well, or perhaps on the very, very tip. That's very similar, but we also learned another really effective way to be using bloodletting when I was in school in Japan. And that's areas of extreme excess or areas of extreme blood stasis, right? And so there's no area that is more easier to see than blood stasis than when you have little spider veins that are popping up. Now, I very specifically am saying spider veins over varicose veins because the varicose veins actually, this is not a really great treatment to directly treat the varicose veins, because within the varicose vein, right, we have a decomposition of the artery and the vein wall. Varicose vein, so the vein wall, excuse me. So the decomposition of the vein wall is causing that plumage, right, that severe sticking out of the vein that you can really see on the skin surface. Sorry, I almost started speaking Japanese there. However, on the opposite, the spider veins, they just look like little teeny squiggles of red lines on the skin surface. Now, these little spider veins often show up above and below cuts. And so what that looks like, and I'm sorry I can't show you directly a good example here on a live, but let's say that we have an incision, right, that maybe is on the arm or on the thigh or even on the back. Usually above and below that incision, and sometimes even around it, you'll get, I wonder if I have a little red marker. I don't. You'll get these little, either barely visible, or you'll start to see these little squiggly red, sometimes almost purple spider veins above and below. Right? And these are really great places to start utilizing your bloodletting technique, because they are the actual visible place of blood stasis. The blood stasis, of course, caused by a cut to the tissue, causing the blood to not flow correctly and causing the key to then also not flow correctly. So it can help with key stasis and blood stasis in this instance. Another really great way, to use this is, of course, when you have excess on the upper shoulders, for example, right? Or if you have RA. I've had a lot of exceptionally great results with clients who have RA using bloodletting very specifically. Now, when I use bloodletting, I do not use cups. I use a massage technique. I'm not going to cover that today in this video, but the reason why I like doing that is because it leaves less of a bruise than the big cups. And then also it's easier to clean up after, right? Because you don't have to clean the cups and all that good stuff. Anyway, so that's a very short video on bloodletting. Again, I've taught this so many different times. I've learned it in Japan and utilized it on hundreds of clients. It's an incredibly great technique. If you can learn how to do it with a little bit less pain and a little bit more specificity, like just being exact on where you want to use it, it can be incredibly life-changing to the clients. So I'm just going to leave you with a little bit of a story of one of the clients that I will never forget, of whom I used bloodletting on, and it was kind of life-changing for her. So this specific client came to me with RA. She had a severe case of RA, wasn't able to move her neck, actually left or right, more than maybe 5 degrees in range of motion. And then 20 years previous, she also had had her tissues actually ripped from her spine by a chiropractor, unfortunately, who was not very good at his job. No longer has his license, thankfully. And since that experience, her RA, of course, was full body, but in particular had really amassed around that injury to the spine, which happens often with RA clients. It skips around to the joints, but in particular, that pernicious key, that pernicious element will really latch on to where there's any injuries in the joint. So again, this client came in, she had a lot of issues, but the area in her taiyang around the upper do was just purple black, really poor coloring. And I knew it was blood stasis, but it was her very first treatment. And I try not to refrain doing bloodletting on a first treatment simply because it's a very invasive treatment. And I don't want to over treat my clients. And it's a little bit scarier for a lot of people to be able to accept that kind of treatment. Anyway, I knew that it would totally help her. So I decided to have her explain the treatment to her. And I said, look, I think this is going to really help you. It is a bit more invasive. Would you be okay with me trying it despite it being our first treatment? And she was like, yeah, that's totally fine. Go ahead. And I did this bloodletting treatment on her, the back of her neck. I think at just 2 places. The darkest, thickest blood I think I've ever seen came out in a large quantity. The coloring completely changed to the normal color of her skin, which she had quite an olive tone, a really beautiful skin color, and it totally went back to normal. Her skin complexion on her face brightened. She wasn't quite as severe in her expression here. She didn't have her 11 showing. And also, she was able to get full range of motion with her neck with just those 2 points. So it was, yes, a very extreme treatment for a first-time treatment, in my opinion, a very invasive one for a first-time treatment, but it was life-changing for her. And just the start for many issues for her that just completely went away, RA being one of them. She never had another reoccurrence, as far as I know, of RA to this date. So it can be a really amazing treatment if you can use it correctly. Now, I know that, again, this is just a quick, short live here on YouTube, but if you're interested in learning how to use this technique more in depth, I highly suggest joining ShinKyu University. It is one of many things that I will review with you, both in person and on pre-recorded videos, and in-person live trainings and, in-person live trainings, and also on live trainings on Zoom several times a month. So I would love to learn with you. Again, link is in the description box below to sign up for an interview for the course. And until I see you next time, keep practicing. And don't forget, hit the like, subscribe, and little bell button to be notified of future videos. I hope you had a great time with me today and that you learned a ton. And it's always a pleasure to learn with you. So I will see you next time.